Tomorrow is World AIDS Day, so this morning our health specialist Leah Sarich is here to talk about HIV infection here at home in Alberta. And the number of people newly diagnosed with HIV in Calgary continues to climb. Some doctors think that the message just is not getting across that this is a very serious issue. It continues to be a serious issue.
It continues to be a serious issue. That's exactly right. So the latest numbers are coming from 2013, and what they show is that there was an increase in the number of new HIV infections in Calgary from 200 to 255 from 2011 to 2013. So there has been an increase, and basically HIV is not going away. And one specialist I spoke to says that when he's practicing at the HIV clinic here in Calgary, there are 1 to 2 new infections diagnosed every single week. Every week. Yeah, so it's definitely not going away. Dr. Vaughn tells me he thinks young people are becoming complacent about having safe sex because the messaging is just not out there the way it was years ago.
If we take a look at other STIs, so sexually transmitted infections, which I like to use as sort of a marker of unprotected sex, because if you see chlamydia, gonorrhea, syphilis rates going up, what that says is people are having unprotected sex. And in Alberta and Canada, we're seeing increasing rates of all STIs that suggest that people aren't using condoms when they have sex. So that message really isn't getting across and potentially putting these people at risk of acquiring HIV.
Yeah, so there you go. Also at play, the infection is not killing people the way it used to. So it's less scary for a lot of people. But that said, there are 2 populations that generally come down with HIV. So one, this population, they're identified early, they engage in care, and they do very well and live an average life expectancy. The other group, however, does not engage in care. They have other issues, maybe drug addiction or poverty, something that's preventing them from getting the care that they need. These people are still dying from HIV today. So that's in fact what's going on. But the treatments are there, and they're better than ever too. In fact, in the past, patients would have to take, a handful of pills several times a day. But now what's happening is they can take 1 pill once a day.
And this has been a hot issue in the news lately with Charlie Sheen coming forward saying that he does in fact have HIV. So what does that do for awareness?
Right, so I asked Dr. Vaughn that exact question, and he says, he said it's good to raise awareness, but the one thing that bothered him was when Charlie Sheen kept saying that it was impossible for him to transmit the infection. And Dr. Vaughn says nothing is impossible when it comes to medicine, or when it comes to transmitting HIV. And he says, yes, if someone is taking their medication consistently and appropriately, their risk of transmitting the infection is very, very low, but it's not zero. It's not zero. And it also implies that being HIV positive is not such a big deal and people are living full lives with it. That is in fact true, but the reality is there is no cure for HIV. It remains a chronic illness that needs to be managed for a lifetime.
This is a chronic infection, so that requires you come to the clinic every 4 months to see us. You have blood work every 4 months for the rest of your life. You take a pill once a day for the rest of your life. So there is a lot of time and effort that has to be put into managing this disease for the rest of your life.
There you go, for the rest of your life. That's worth keeping in mind. The big message again, if you're HIV positive, take your medication properly and consistently, because treatment of HIV is prevention of HIV. And if a new patient stops taking their medication, even if the virus is undetectable in their system, it will come back. Even for people like Charlie Sheen, that virus will come back as soon as they're off their medication. So practicing safe sex, not using needles, sharing needles, that kinds of thing. Also, Dr. Vaughn is encouraging everyone to get tested at least once in their life. Everyone. Right across the board. He says, of course, if you're caught early, then you can do better with the disease through the long term. And the earlier you're diagnosed, the sooner you can be treated, of course. And then, of course, that reduces your risk of infecting anybody else. So that's the big message.
Okay, and more information on your blog.
On my blog, as always, and of course, tomorrow, World AIDS Day.
Okay, ahead of World AIDS Day. Thank you very much, Leah. And on over to our Craig Larkins, who's spending the morning at the State Culinary Campus, dressing up some potato pancakes.